Hi guys, so I am going to be looking down at my notes so I don't forget anything. And I did wanted to let you know about my POTS diagnosis. I went to the doctor a few days ago because my electrophysiologist told me that I needed to see some sort of cardiologist specialist. And because he thinks that because I do have ventricular tachycardia, I was having like high blood pressure, low blood pressure, dizziness, and I thought I was going to faint all the time. So he said that I might need to see another doctor that has nothing to do with the ventricular tachycardia. It is something else. So he thought I might have POTS, and actually I do. So POTS is postural orthostatic tachycardia syndrome. Basically, it affects the circulation, and you're supposed to get it once you're like getting up. So like if you're like in a laying position and then you stand up, the increase of heart rate, I guess tachycardia, makes it that you have POTS, but there's more symptoms to it. And some people have all the symptoms, some don't have all the symptoms. Like I don't. I have just a few, and because of that I wasn't too sure that I did have POTS. But the doctor, he asked me quite a few questions. We went through the medical history, like my past medical history and some of the family medical history also, and he determined that I do have POTS. And of course he is the expert, so but I'm glad that we were able to find out what's wrong with me. Now, just so you guys know, there are different kinds of dysautonomia. I think that's how you pronounce it. I guess conditions, and one of them is POTS. So someone it's kind of like an umbrella of different conditions, and it's a dysfunction of the nerves that regulates non-voluntary body functions, kind of like heart rate, blood pressure, and sweating. So I was trying to do some research about it, but there's just so much information that I was just a little bit overwhelmed. So I just decided for the doctor to just explain me, and he said the same thing. It has to do with the nervous system and the non-voluntary functions of the body. Now, I gather a list of symptoms that I do have that correlates with the POTS diagnosis, and those are tachycardia, which is fast heartbeat, hypertension, which is high blood pressure, and hypotension, which is low blood pressure. So I get high and low blood pressure out of nowhere. So sometimes I just feel dizzy, like I'm about to faint. Out of nowhere, I check my blood pressure, and it's most likely high. I take my medication, which is the one that I'm supposed to be taking is the metoprolol, but the doctor told me not to take it anymore, and take something else, which I am going to mention. But yeah, so I have high blood pressure, and then I do have low blood pressure most of the time. So usually it's about 90 over 60 on my everyday, I guess on the daily. And it does go lower than that when I feel lightheaded, but when I feel very dizzy, like I'm about to faint, that's usually when I have high blood pressure. Dizziness comes with it, so I am pretty much lightheaded most of the day, and I do get very dizzy at times when my blood pressure either goes really high or really low. Chest pain. I did have really bad chest pains when I was pregnant, and it actually kind of went away, but recently I've been having a little bit of chest pain, but it's only like a few minutes at a time. I'm sorry, not minutes, a few seconds at a time. So I really don't think too much of it at the moment. Palpitations, I do have that, but it also comes with a ventricular tachycardia. So I do have to keep track of it. So I have the Cardia Mobile EKG and the app on my phone. So I try to keep track of the tachycardia to see if it's coming from the ventricular tachycardia or if it's from the POTS. So fatigue, I'm always very tired and kind of out of breath. Fainting, I did faint before. I fainted, I think last time was about 5 years ago. But there was a period of my life that I would get very dizzy, and it was more like vertigo, like the room was spinning. Now it's just kind of like regular dizziness, I guess. And I haven't fainted in a couple of years, which is great, but I always feel like I'm about to. But it actually never happens. Well, it doesn't happen anymore, which is great. Nausea, I do feel nauseous. Sometimes, it's not always. Anxiety, I did suffer from really bad anxiety when I was pregnant, but I think it was the hormones. It did get better a few months after pregnancy, but I do still have it from time to time. GI issues, so stomach issues. I do have GERD, which is the acid reflux, but I had it since I was a kid. I remember in second grade I got an endoscopy, upper GI endoscopy done because of that. Sleeping trouble. I do have a baby, so I'm not sure if that has to do with me not being able to sleep, or maybe it's just the POTS. Jittery, I do get jittery sometimes. I feel like when I wake up, I need to eat something real quick. If not, I get super jittery and lightheaded. Now, I usually think that maybe it's like sugar, or I'm just hungry. But it supposedly comes with it, and I get jittery sometimes. When I have a tachycardia episode, at times I get very shaky, and apparently it's a POTS. So, and let's see, exercise intolerance and brain fog. Lately, I have been having trouble remembering things. Not really remembering things, but I guess just with my memory period. I used to have a really good memory. I don't anymore. So, and then exercise intolerance. I don't really exercise anymore because I'm mainly lightheaded all the time. But before, I used to try to work out, but I really wasn't really good at it. I would get fatigued all the time, very like maybe within 3-5 minutes of working out, and I couldn't really do any cardio because I would get very dizzy and I would have to stop because I would feel like I was gonna pass out. So I always stopped. And then when I do stand for a long period of time, well, not really long, but for a few minutes, I need to sit down because I also feel like I'm about to faint. And symptoms that I do not have that supposedly people with POTS get is discoloration and swelling of feet and hands. I don't get that. It has to do with the circulation, but thankfully I don't have any problems with that. Also, lack of excessive or lack of sweating. Again, I don't have any issues with that. And diarrhea or constipation. Now, I did some sort of test at home, I looked it up on YouTube, and there was this one girl that I am so sorry, I totally forgot her name, but she has POTS, and she made a video about checking at home to see if you do have POTS. And she said that we could use something like this. This is to check your oxygen and your pulse. And you can just put your finger and it'll just measure your oxygen levels and your heart rate. So basically you have to be laying down for about, I think, 10 minutes, and that will be your resting heart rate. And then you will compare it with you standing up. So you'll just stand up, and if you get an increase of more than 30 beats a minute, that means that you have POTS. Now my increase was of 44 beats per minute, and that's just the average. So sometimes it's a little bit low, sometimes it's a little bit higher, sometimes it stays high for a few minutes, and sometimes it goes down within a minute or so. I did let the doctor know about that and actually recorded it, And he didn't see it, but he just took my word for it. And he's like, okay, well, I guess you do have it. And taking into consideration all of the other symptoms. So he did not do that test at the office. The only thing that they did besides asking me for my information, like in my medical history, was that the nurse had me laying down, took my blood pressure and my pulse, then sitting up and then standing up. She did tell me the numbers, but I wasn't paying too much attention to it because I didn't know they were actually trying to test for it. I thought they were just taking like the regular blood pressure that they take at the doctors. So the doctor told me to basically go ahead and drink a lot of water, 3 liters a day. And then my EP doctor told me about Gatorade, to just do Gatorade instead of water. I'm doing both, but it is kind of hard to drink a lot of water. I feel very nauseous when I do drink a lot of water, which is another symptom of POTS. So I try, but I don't do the 3 liters. Also increase salt intake. So they said 8 to 10 grams daily. So I guess that goes with your cooking, when you're cooking and things like that. Some people do salt tablets. He did not mention that, so I didn't ask him. Compression stockings in thigh high if possible. So he said that if I don't have any stockings, I could do leggings, the yoga leggings, which are tied. So, and also kind of like crossing my legs and contracting leg muscles. I am not very athletic, so I was told to work out more. So they said seated exercises, 30 minutes, 4 to 5 times a week. So I just need to do kind of like workouts, and obviously whatever I could do without getting lightheaded or dizzy. And they want me to take medication to help with my heart rate. Now I was taking metoprolol, and that was fine, and that did lower my blood pressure. But now he wants me to do hyoscine. Hyoscine is HYOSCIAMINE. So that is kind of like my rescue pill, so to speak. He said that every time I will feel like I'm about to pass out, take that medication and just put it under the tongue and it dissolves. And he said that within like 60 seconds, I should be feeling great. Well, not great, but normal, I guess. I have not taken it yet. I just picked it up from the pharmacy yesterday. And he said, don't take that all the time, just when you feel like you're about to faint. And then propranolol is a beta blocker, and he said to just go ahead and take that every day, 3 times a day, instead of the metoprolol. I am not sure about that medication. He said that the side effects are going to be similar to the one that I was taking. But I did read online that once you start taking it, and then if you stop, then your symptoms might get worse. So I am kind of concerned about that. I am going to call the doctor's office and find out about that specific situation to make sure before I do take it. That one is safe to take while you're nursing, and the other one, like the rescue pill, apparently you have to be cautious, the pharmacist said, but he did not say why or how that affects the baby. So basically that was my diagnosis, and those are the things that the doctor told me to do to help. He said the medications will help me feel better, and he wanted to see me in 2 months, and of course if something did happen in between, to give him a call. So I am a little bit hopeful about the medication and things that he told me to do to feel better. I am kind of scared to take the medication. I'm very sensitive to prescription, but I am hopeful. So I will keep you guys updated, and I will try different things to see what works best for me. And if I do improve, So yeah, so that is it for today, and I hope you have a wonderful day.